U-Step rolling walker for many years now because I find it is the safest assistive device to use with anyone that has a problem with gait or ambulation. Some of the movement disorders that I work with in addition to Parkinson's disease are multiple sclerosis, progressive supranuclear palsy, strokes, and multiple systemic atrophies. Now, the main thing that I like about the U-Step rolling walker for my Parkinson's patients is that it has a red laser beam, which we use as a visual cue for freezing episodes. The Parkinson patient begins to freeze, and when we turn this on, they immediately walk over the red line and resume their ambulatory treatment. Another excellent feature about this U-Step rolling walker is that it has an extension. So for your patient who has difficulty holding on to the brakes, can just rest their hands on the extension and push it as they would a grocery cart. Another excellent feature of this U-Step rolling walker is that it tends to give a very neutral pelvis. We do not want posterior tilting, we do not want anterior tilting. We want a very neutral pelvis with any movement disorder while ambulating, because this is what will assure us of good vertical postural alignment. So when you have your patient, again, move around and sit, you can be examining symmetrical shoulders, chest out, eyes at eye level. I also have used this U-Step to improve gait, and it has probably been the most helpful assisted device for gait that I have ever used. If I am having difficulty with a patient with too much anterior tilt, I will use this red laser beam as a cue at the metatarsals so that they will keep the knees forward, again the chest up, the eyes at eye level. And I also will use it as a visual cue for basis support and for keeping those knees and legs extended and straight. The fact that this has cut down so many falls with my patients has been so important in this age where Medicare wants us to be more responsible with improvement in our patients. I have never had any patient where I did not put down as my first goal fall prevention, reduce falls from 6 a week to 0. 0 is always my goal. I have been able to achieve it with this U-Step rolling walker. This walker can be adjusted to any height. It is very helpful for my very tall and lanky patients, 6'1", because it gives them full extension. Again, it helps the postural alignment, it helps the gait, it helps that neutral pelvis where postural alignment really begins, and it keeps them in an upright position. I want to tell you about the seat and the different ways we can use the seat on the U-Step rolling walker to enhance our patients' endurance. The seat is a wonderful, comfortable addition to this walker that I use with my lower functioning patients to teach them how to lift their feet, maintaining their base of support, and to make a turn, a nice safe turn, and to sit. Now as they're sitting, they can use this extension, and you know that your patient's safe and they will not be falling backward. And what I use it for mainly is if we begin with 5 minutes of ambulation, then I teach them how to turn and how to sit, and we'll sit for 5 minutes. And we'll either do breathing exercises, or we'll do leg extension exercises, knee flexion, and then in 5 minutes they're ready to stand. Maybe you want them to stand a couple minutes for standing endurance, and then you want them to turn, and they can resume their ambulatory treatment. Now in another 5 minutes, you might want to have them again turn, sit, rest, or exercise, and then increase your walking until 7 minutes. Thank you. Dorian Brown with Dorian Brown Occupational Therapy, LLC.